Hi everyone, welcome back with a new video on free radicals and antioxidants. Now in this video we'll be seeing what are free radicals, what are the various free radicals, how are free radicals generated in our body, yes, and what are antioxidants, types of antioxidants, right? So what is a free radical? It is a molecule that contains one or more unpaired electrons in its outer orbital. Now the oxygen atom contains 8 electrons. Now see how the electrons are placed. In the first orbital 2 electrons are there, and in the outer orbital there are 6 electrons. It is fully satisfied. Yes. Now consider the second one, which has only 7 electrons. So what happens here? One electron is unpaired. Yes, one electron is unpaired. So this unpaired electron in the outer orbital makes this atom a unstable molecule or highly reactive molecule, right? Why is it so? Because it tries to satisfy itself by borrowing electrons from other molecules, making them a free radical. Yes, so it will always be highly reactive because it will always be in a state of borrowing. So it will try to satisfy itself. Now the various free radicals are superoxide radical, hydroperoxide radical, hydrogen peroxide, hydroxyl radical, lipid peroxide radical, singlet oxygen, nitric oxide, and peroxynitrite. Yes, so in all of these I have kept a superscript dot. So the free radicals are denoted by a superscript dot. Yes, so the free radicals are denoted by a superscript dot. Now this hydrogen peroxide and singlet oxygen do not have superscript dot because they are not free radicals, but still we have grouped them under this free radicals because of their extreme reactivity and other characteristics of free radicals. Yes, they are extremely reactive, they cause damage to your tissues, they have all other characteristics of free radicals, so they are grouped under this. Now what are the different characteristics of free radical? One is they donate an electron or accept an electron. Yes, so because it has an unpaired electron in its outer orbital, it will always be in a state of borrowing electron from any other atom or molecule, or it will donate an electron to some other radical, right? So it has extreme reactivity because it has unpaired electrons in its outer orbital. It is unstable, it has short lifespan, it generates new free radicals, reactive oxygen species by chain reaction, and it causes damage to various tissues. So these are the important characteristics of a free radical. Now generation of free radicals. So how are these free radicals formed? The endogenously, how are they formed? By respiratory burst. The respiratory burst is an antibacterial mechanism that happens in the macrophages whenever bacteria enters into it. Then electron transport chain. Whenever there is an electron leakage in the electron transport chain, because we have 4 complexes. Yes, there are 4 complexes along with ATP synthase complex, wherein the electrons are transferred from one complex to the other. So during this transfer, when the electrons are leaked, they can be involved in the generation of free radicals. Next is lipid peroxidation, which we will see shortly. And inflammatory conditions, nitric oxide synthase mechanism, where nitric oxides are produced in macrophages. It can also be considered as an antibacterial mechanism, and some enzymatic reactions which lead to the formation of free radicals. And exogenous causes are UV light or inhalation of air pollutants, ionizing radiation, smoking. So these causes generation of free radicals in our body. Now what is respiratory burst? So whenever bacteria enters a phagocytic cell, macrophages, what happens? The oxygen gets converted to a superoxide anion radical. This is the respiratory burst. This is due to the enzyme NADPH oxidase. So NADPH oxidase is involved in the formation of free radicals, right? Now this superoxide is converted to hydrogen peroxide by superoxide dismutase. Now hydrogen peroxide combines with the chloride ion to form hypochlorous acid by the enzyme myeloperoxidase. Now this hypochlorous acid kills bacteria, right? So this is responsible for the antibacterial mechanism. So the respiratory burst is involved in the formation of free radicals, right? So as we can see, NADPH oxidase, superoxide dismutase enzymes are involved in the formation of free radicals like superoxide anion radical and hydrogen peroxide. Now this is respiratory burst. Now what are the various enzymatic reactions which lead to formation of free radicals, which are involved in the formation of free radicals? One is xanthine oxidase. Now xanthine oxidase enzyme explains reperfusion injury after myocardial ischemia, right? So ATP, all of the ATP gets converted to hypoxanthine, which gets converted to xanthine. This is by the xanthine oxidase enzyme, which converts oxygen to oxygen, a superoxide anion radical, which in turn gets converted to hydrogen peroxide. This hydrogen peroxide can give hydroxyl radical or other free radicals. So the xanthine oxidase enzyme is involved in the formation of free radicals. Likewise, NADPH oxidase, as we have seen in the respiratory burst, and nitric oxide synthase is also an antibacterial mechanism. Superoxide dismutase and beta oxidation in peroxisomes. So very long chain fatty acids undergo beta oxidation in peroxisomes. So as it undergoes beta oxidation, instead of energy, what is produced? Hydrogen peroxide is only produced, right? So this again leads to formation of other free radicals. So these are some of the enzymatic reactions by which free radicals are generated. Now the other mechanism which generates free radicals or causes cell membrane injury, which is responsible for many clinical manifestation, is lipid peroxidation. Yes, so our cell, we all know our cell membrane is made of a lipid bilayer. Yes, and mostly polyunsaturated fatty acids. So this lipid bilayer, which has polyunsaturated fatty acid, when it undergoes peroxidation, what happens? The cell membrane is damaged. There is loss of cell membrane functions, which can lead to various clinical manifestations. So be it inflammation or respiratory diseases or disease of the eye or reperfusion injury, myocardial infarction, any skin diseases, cancer, all of these can be attributed to free radical toxicity, and all of them can be attributed to lipid peroxidation of the cell membrane. Now it has three phases. One is initiation phase, wherein the free radicals, lipid radicals are generated. Propagation phase, wherein there is a chain reaction by which all of the neighboring cells are attacked and more of lipid radicals are generated, and the membrane, there is loss of membrane function. And then termination phase. Now the lipidization phase is the production of the PUFA radical or the lipid peroxide radical. So how does it happen? Whenever your lipid reacts with a free radical, or whenever the lipid is attacked by free radical, when your cell membrane is attacked by free radical, lipid radicals are formed. One is a PUFA radical or a lipid radical, and the other one is lipid peroxide radical. So these radicals can be formed. The next phase is the propagation phase. Propagation phase, what happens? In the propagation phase, this free radical or the lipid radical will rapidly react with the molecular oxygen, and it will form a peroxide radical. Yes, this can attack other polyunsaturated molecule. Yes, so the lipid radical can easily react with an oxygen, molecular oxygen, and forms lipid peroxide radical. This lipid peroxide radical can attack other PUFA molecule or the other lipid molecule, forming another lipid radical. So this is the propagation phase wherein there is more production of free radicals. This becomes a chain reaction. So we have seen already, so for a free radical to satisfy itself, it will attack another molecule, right? So this is what is happening here also. So finally our cell membrane gets damaged. So when does it stop? It stops at a termination phase where they say when one free radical combines with another free radical, or when one free radical comes in contact with another free radical, only then this chain reaction stops, which is very rare. Let's see. In all of these reactions there are two free radicals. Yes, when the two free radicals combine or they come into contact, only then they can satisfy themselves, because both of them will have unpaired electron in its outer orbital. So when they combine with each other, it becomes a the all of the outer orbital becomes paired and satisfied. So there is the termination phase. So what are the three phases of lipid peroxidation? One is the initiation phase, wherein the lipid radical and there is a PUFA radical and lipid peroxide radical are formed. And then the propagation phase, which is the chain reaction wherein one lipid radical attacks the other PUFA molecule, making it another free radical. So this is a chain reaction, and termination phase happens whenever two free radicals come in contact with each other. Only then it will become inactive. Okay, so this is a lipid peroxidation cycle wherein free radicals are again generated. So who will scavenge these free radicals? Free radical scavenging systems are mainly enzymes. Not only enzyme, there are other non-enzymatic free radical scavenging systems. That's what we call it as vitamins and minerals, right? So we'll see that later. So the enzymes are superoxide dismutase, glutathione peroxidase, glutathione reductase, and catalase. So look at this. We have already seen the function of superoxide dismutase. What does it do? It converts the superoxide anion radical to a hydrogen peroxide. Yes, it converts it into hydrogen peroxide. Now this hydrogen peroxide has to be again scavenged, because this itself has the characteristics of free radical. Now what happens, which helps in removing the free radical effect of hydrogen peroxide? That is nothing but the reduced glutathione. Yes, so you need reduced glutathione in your cell so that it combines with hydrogen peroxide, converting it into two molecules of water. Yes, by giving its hydrogen. So as it gives it hydrogen, it becomes oxidized glutathione. So which is the enzyme which is responsible for this? It is the glutathione peroxidase enzyme. So glutathione peroxidase enzyme converts the reduced glutathione to oxidized glutathione. Thereby it gives off its hydrogen to the hydrogen peroxide, forming two molecules of water. Now again you need only reduced glutathione to scavenge this hydrogen peroxide. So to replenish this reduced glutathione, we use glutathione reductase enzyme, which converts the oxidized glutathione to reduced glutathione. So we need glutathione reductase to maintain the levels of reduced glutathione in the cell. Now again, how do you replenish this? By using NADPH, right? So the H of this is given to the oxidized glutathione to form reduced glutathione. So this NADPH, how do we get this NADPH? From HMP shunt pathway. Yes, from HMP shunt pathway. The enzyme necessary is G6PD deficiency. Yes, G6PD deficiency. The enzyme necessary is glucose 6 phosphatase dehydrogenase. So what happens in G6PD deficiency? NADPH is less. Yes, so as your NADPH is less, the free radical scavenging mechanism is reduced in patients with G6PD deficiency, right? Yes, so the hydrogen peroxide, for you to scavenge the hydrogen peroxide to 2 molecules of water, you need glutathione peroxidase, so that you convert the reduced glutathione to oxidize glutathione. Now again, to replenish reduced glutathione, we use glutathione reductase and NADPH. The NADPH is from the HMP shunt pathway, and the enzyme necessary is glucose 6 phosphatase dehydrogenase. Right? So that's superoxide dismutase, glutathione peroxidase, glutathione reductase. So these enzymes are necessary for removing your free radicals. And one more enzyme is catalase. Yes, one more enzyme is catalase, which converts hydrogen peroxide to water and a molecule of oxygen. Yes, so this is the function of catalase. So what are the 4 enzymes which are responsible for free radical scavenging? Catalase, glutathione peroxidase, glutathione reductase, and superoxide dismutase. So antioxidants, what are the antioxidants? Antioxidants can be enzymatic or non-enzymatic. What is the function of antioxidants? It is also a free radical scavenging material. Okay, so what does it do? We have the unpaired electron in the outer orbital in case of free radical. So the only way to make this free radical inactive is to give one more electron to its outer orbital, making it paired and making it inactive and unstable, right? So any molecule can do that. So we are actually doing it with the help of antioxidant. So what happened when you do it with the help of antioxidant, like your vitamin E or vitamin C or any mineral? What happens? These antioxidants can donate its electron. Yes, these antioxidants can donate its electron to the free radical. Thereby this will not convert into a free radical, okay, dangerous free radical. Instead, we can again replenish this antioxidant by other mechanisms. Yes, and this, even if it becomes a radical, it is not damaging. Okay, so that is the function of antioxidants. So we'll see it soon. So the enzymatic free radical scavenging systems will be what we have seen already, and non-enzymatic will be called antioxidants, which are vitamin C, E, A, minerals like your selenium and zinc, of which the important ones are vitamin C, vitamin E, and minerals like selenium. And antioxidants can be of 2 types in another classification. One is preventive and the other one is chain breaking. So preventive antioxidants is that it will prevent the production of free radicals. So it will prevent the production of free radicals. So examples will be catalase and glutathione peroxidase. And chain breaking antioxidants is that they inhibit the propagative phase. Okay, they inhibit the propagative phase. So you already have free radicals generating in a much larger scale. So you have to try to inhibit this propagation. So for that you can use the chain breaking antioxidants. So that is why we supplement with vitamin C or vitamin E or vitamin A. Yes, selenium. These are all chain breaking. So already you have free radicals getting generated inside your body. So you can only give these chain breaking antioxidants to stop the chain reaction and stop the further production of free radicals. So look at this. Now the free radical is generated. This is the cell membrane. Yes, this is the cell membrane. So outside of this, in the cell membrane, what happens? your vitamin E acts. So the action of vitamin E is on the cell membrane. So what happens here, due to the free radical chain reaction, a PUFA peroxide radical is being generated. Yes, so lipid radical or lipid peroxide radical are generated. Now we have to break this lipid peroxide free radical. We have to satisfy this, otherwise what it will do, it will attack another lipid molecule and it will convert it into a free radical. So we are trying to do it with the help of alpha tocopherol. What is it? It is the active form of vitamin E. So alpha tocopherol gets converted to an alpha tocopherol radical, thereby it converts the lipid radical to a stable form. Yes. So this alpha tocopherol radical or the vitamin E radical which is formed in this reaction can again be converted to alpha tocopherol with the help of vitamin C. Right? So this vitamin C, the reduced form of vitamin C, can convert into oxidized form, thereby your tocopherol radical can get converted to alpha tocopherol. Now again this vitamin C is replenished by converting the glutathione oxidized glutathione to the reduced glutathione. So this PUFA which is being formed can get converted to PUFA and hydrogen peroxide inside the cytoplasm. So if this happens, the hydrogen peroxide can get it should be removed by catalase and converting it into water molecule. Now this not only is done by the catalase enzyme but also by a mineral selenium. So the selenium can also convert hydrogen peroxide to water. And in this reaction, what is needed? The reduced glutathione has to get converted to oxidized glutathione by glutathione peroxidase enzyme. Right. So in this picture, you will be able to understand the effects of vitamin E, vitamin C and selenium. So vitamin E's action is whenever the lipid radical is outside the cytoplasm, it is in the cell membrane. The action of selenium is inside the cell. Yes, in the cytoplasm, whenever the radical has entered inside your cell. Now the vitamin C's action is to replenish the vitamin E. Yes, now the free radical which is formed, yes, the lipid peroxide radical which is formed is acted upon by the antioxidant alpha tocopherol. In this process, the alpha tocopherol gets converted to a radical. That radical can be converted or it can be replenished by the help of vitamin C. Yes, now this again, or whenever a free radical has entered inside the cytoplasm, the selenium can act on the hydrogen peroxide, converting it into water. And in this process, what happens? Which is helping the reduced glutathione is what is helping. Also, to replenish vitamin C, you need reduced glutathione. Okay. Also, to replenish vitamin C, you need reduced glutathione. Now, to replenish reduced glutathione, what do you need? You need NADPH. Yes, to replenish reduced glutathione, you need NADPH. So, to replenish the vitamin E radical, you need vitamin C. To replenish vitamin C, you need reduced glutathione. To replenish reduced glutathione, you need NADPH. Yes. Likewise, whenever hydrogen peroxide is inside the cell, can be converted to water with the help of selenium, and during this process reduced glutathione is what is helping. Now to replenish reduced glutathione, you need NADPH. Yes, so this is it. So this is the function of antioxidants. By doing so, what happens, even if the vitamin E is getting converted to a radical form, it is not damaging your cell membrane. Yes, it satisfies this lipid radical, making the molecule inactive. Also, it is not damaging the cell membrane. The vitamin E molecule is also not damaging the cell membrane. So that is the uniqueness of antioxidants, right? So with this we are completing. We have seen what is a free radical. We have seen various mechanisms by which free radicals are generated, and what is lipid peroxidation, what is respiratory burst. Yes, also we have seen antioxidants. So what are the free radical scavenging systems involving enzymatic reaction, and which involves non-enzymatic reactions like your vitamin E, C and selenium.